Republican Senate Majority Leader Bill Frist and Democratic Senator Hillary Clinton are normally adversaries on, well, just about everything. But today they're coming together to announce a new bipartisan health care initiative. Senator Frist and Senator Clinton, good morning to both of you.
Good morning.
Senator Frist, right before we start, though, I do want to address the big headline today. You were so instrumental in efforts to involve Congress in the Terri Schiavo case and keeping her alive. And as you know, the autopsy findings were released that she did have massive irreversible brain damage. What was your reaction?
Well, I haven't seen the report itself, but I believe it does bring a very sad chapter to a close. We all knew that she had devastating brain damage. This was documented today. We feel for the family. We know there was a lot of discussion and a lot of media attention, and hopefully this brings us to a close. The diagnosis they made is exactly right. It's the pathology. Respect that. I think it's now time to move on.
All right, Senator Clinton, it's nice to see the two of you on the same page here with something as you come together for this very important health information technology legislation. For average Americans, how is this going to change and improve their health care?
Well, we believe it's going to be a dramatic change, and here's what it will do. It will create an electronic medical record that is secure and confidential for every American. It will provide immediate access to important health care information to physicians treating you, to nurses who are looking after you, to hospitals and nursing homes who are taking care of you. And it will enable your doctor in New York to talk to a doctor in Tennessee if you were to travel from New York to Tennessee and need medical assistance, and it will cut the time and the mistakes that unfortunately get made because people don't have accurate information at their fingertips, and lower the cost of health care because we won't need to be duplicating tests and doing things over. We'll have all the information in one place.
Senator Frist, it's interesting that you are coming together. It's been such a divisive climate in the Senate. Why cooperate on this issue in particular?
Well, Hannah, this gives us a great opportunity. I think it's demonstrated by the two of us being here today that we're in a world today with miracles in medicine, whether it's the heart transplants that I have done in the past or just delivering a baby today with all the technology available. Yet in spite of that, we have huge inefficiencies in the healthcare system that diminish the quality of care, that mean more medical mistakes are made, and at the same time drive up the cost of healthcare for everybody listening to us today. Thus, we're going to hit it head on in a nonpartisan way over the next 18 months, working with the administration, bipartisan way in the Congress, to establish a technology system of health information that will empower patients, consumers, you and everybody, to get information that they can use, and at the same time, as Senator Clinton just said, allow the 900,000 doctors out there to communicate one with another with the 6,000 hospitals and 4,000 community health centers, none of whom communicate one to another today electronically. It'll lower the cost, it'll reduce the mistakes that are being made, and drive up the quality of health care.
Senator Clinton, American citizens would really like to see more of this type of cooperation and action in Congress. A recent Gallup poll showed that 59% of American citizens, that's such a high number, disapprove of Congress's performance. The president is getting frustrated. He said this week, lashing out at the Democrats, that they were delaying solutions and obstructing progress. And what's your reaction to that?
Well, I think this is a perfect example of what we can do when we do work together. Senator Frist and I started talking about this issue over a year ago. We have been working steadily toward the introduction of this legislation, and we really see this as not only an important piece of legislation that will improve the quality of our healthcare system and decrease costs, but as an example of coming together to solve a problem that we have to address as a nation. So whenever there are opportunities to work together, I know that we're going to try to do that because, I agree with some of the frustration that Americans feel. We have real challenges confronting us. This is one of them, but there are so many more, and we do need to try to find solutions.
And Senator Frist, speaking of solutions, many have accused the Senate of playing party politics here with this John Bolton nomination as ambassador to the UN. Are you going to try for a vote on that again today? And what is the future of that nomination? How can the two parties come together? The Democrats say they want information that the Republicans aren't giving.
Well, I think that we will come together. I think if you look what we're doing on the floor of the Senate today, we'll go over and work on energy policy, and I expect we'll pass that in a strong bipartisan way after a lot of debate and amendment over the next week and a half. We're passing a highway bill over the course of the next week and a half. We've already done it in the Senate, again, working together. Our being here today on what I believe is the number one problem addressing the country domestically today, and that is the cost of health care. The fact that the two of us are on your show today. There can always be issues, whether it's the judges or whether it is John Bolton's nomination, that there is going to be a contrast of ideas. We take that to the floor. We ultimately, just like with judges, work it out. It's tough, it's messy, it looks chaotic, but ultimately we get to a solution. And we hopefully will be able to, well, the president's nominated John Bolton. We'll take it to the floor. We'll see whether or not he has the votes, and if so, he'll be confirmed. I don't know whether we'll be voting on it today or not, but in the very near future.
All right, Senator Frist, Senator Clinton, nice to see the two of you together. Thanks.
Thank you. Thank you, Hannah.
Good to be with you, Hannah.